and thank you for joining me tonight. If this is your first time visiting, I present a different topic on related to Parkinson's disease and brain health through nutrition and active lifestyle with fitness and mindfulness. Tonight I'm going to give you 3 tips for safe dental care that can help reduce Parkinson's symptoms. Caring for our teeth and dental hygiene has been ingrained in us to brush our teeth 2 to 3 times a day, floss, and keep our teeth nice and shiny white. An annual checkup at the dentist does a sufficient cleaning job, removing plaque buildup and keeping our teeth good enough condition. When things start to go wrong, such as gum decay or major tooth aches, we have to confront our dentist to fix the problem, and we'll do anything to get rid of the pain. We may need a filling, a crown, a bridge, or a root canal. Our dental health is an underrated area of our body. It never gets enough recognition for how important it is, or maybe because the dental bills are just so exorbitant. What happens in our mouth has huge implications that affects many areas of our body, and we don't even realize it. It's our teeth, our bones, our sinuses, our digestive system, heart function, and detoxification of eliminating waste out of our system. For many people living with Parkinson's disease, dental care is really important to manage. It's another thing to think about coping with daily symptoms of tremors, freezing, balance, and speech, or non-motor symptoms of depression, anxiety, sleeplessness, and constipation, just to name a few. And you're probably thinking, teeth are the least of my problems, another thing to worry about. But yet, not necessarily so. Dental care is a combination of several factors, such as eating a nutritious diet to avoid getting cavities, maintaining your pH balance in your mouth, and reducing the bacteria plaque buildup. However, past treatments used for dental care is a whole other problem that has evolved over time. The materials used to fix our dental problems that are put in our mouth, such as metal fillings, crowns, root canal bridges, implants, and anesthesia, are for short and long term have major implications. The challenge is the body's ability to detoxify mercury or heavy metal from those products. These toxins are suspected common causes of Parkinson's disease that impair cognitive, motor, and speech function. So I have a brother with Parkinson's, and I also had an uncle who passed away from it too. And my cousin just today informed me that his father, who had Lewy bodies, Parkinson's, and Alzheimer's, had extremely high levels of mercury when he was originally diagnosed. Actually, he had Parkinson's Lewy bodies. They thought it might be from the amalgams because he had a lot in his mouth, but also he was a big tuna fish eater. He had a sandwich every day of his life, I think for 35 years, I was told. So it's probably a combination of both, but it's interesting to note that he had tested his metal levels, and it tested high for mercury. So I find that very interesting. Metal toxicity disrupts our cellular function at all levels, specifically mercury. Within the cell can destroy the various components, releasing lipsosomes, which are part of the digestive enzymes, damaging DNA, and rupturing the cell membrane, like significant damage. It affects neurological and reproductive system, which have been extremely documented over the years. It is super serious and is a known cause of many symptoms people experience every day, such as fatigue, sleeplessness, migraines, foggy brain, neurological function disorders, motor dysfunction, cancer, heart disease, rheumatoid arthritis, and other autoimmune diseases. It also causes digestive issues, and the list is endless and goes on and on. It's significant, and it has been around for hundreds, probably thousands of years, that people have been struggling with heavy metals in their system. Now, you may be familiar with the popular references made in our culture of the effects of heavy metals on our health. For instance, there's the Mad as a Hatter from the 1800s, which referred to the use of mercury in the sizing in the hat manufacturing. Or gold fever from early prospecting in Alaska or the Yukon. Lead poisoning from glazes in the ceramics, or it's currently has a black humor for getting shot. crazy associations, if you ask me, and more recently, get the lead out from trainers doing extreme fitness exercises, pushing their clients to sweat and sweat out toxins and reduce fat. So that's really extreme. I don't really like that term. But anyways, while it's funny, heavy metals have been carried through the generations for centuries, and unfortunately, it's partly in our DNA. So to tell you about the role of dental care and amalgams, mental amalgams were used to fix cavities in our teeth and for creating other dental repairs. The amalgam fillings contain cadmium, zinc, tin, copper, silver, and mercury. Metal crowns are a problem with any metal, even expensive gold ones, which were used quite a lot for many years. And porcelain crowns may also have metals in them as well that are hidden. Plus root canals, implants, partials, and dentures all have some kind of metal in them. Today, ceramic fillings are used to fill cavities in your mouth instead of the metal toxins. And it's important to find out from your dentist what he's using and how the process that he's using it, so that those metals are not getting lodged into your teeth or dripping into your gums. They should be removed. If you do have amalgams, they should be removed because they are very corrosive in your system. And you should also look at you should also look at other dentists, which I'll talk about in a minute. So it also causes a major threat for people with Parkinson's because it really corrodes and deteriorates their symptoms even further. So you really want to get those metals out of your body. Now, the buildup of bacteria, especially if you've had a root canal. So when you're sitting in a dentist chair and you're in a lot of pain and you're told you have to undergo a root canal, at that time you're not thinking, hey, what are you doing with putting in my mouth? You just want the pain to go away. But you should consider asking, because a buildup of bacteria in your mouth can cause infection and be very painful. During the process of root canal surgery, after the root is extracted and then the gum is sewn up, bacteria can become trapped inside, unable to seep out. If an infection occurs, it's impossible to access and more surgery is required. Well, the process that you have to go to even find where that location is can be very difficult and very painful. The metals and materials used are highly toxic and can seep into the body or react to bacteria methylated in the mouth. So here are 3 steps to remove heavy metals. You want to go to a biological dentist, not your regular dentist, a very trained holistic dentist who knows how to remove amalgams and heavy metals safely. Removal of amalgams must be performed using a dental protocol that's very specific, I'm going to explain that in a minute, established by the International Academy for Oral Medicine and Toxicology. The second point is remove your amalgams one at a time. It is recommended to remove the amalgams one at a time because the mercury or vapor, it's a type of gas called monotonic gas, is released from dental fillings, can be very toxic for the body. It can be absorbed very rapidly by swallowing or inhaling. Your body needs to take time to properly detoxify the heavy metals out of its system before removing another amalgam. Specialized dentists have mercury vapor collectors, which I found very interesting, that dispose of the amalgams and will not pollute the environment. And even they have them for before cremation, when they're preparing the body after death, they will remove any amalgams. I thought that was very interesting. According to the International Association of Oral Medicine and Technology, there's a specific protocol to remove the mercury, which is a multi-step process. The first step involves changing the diet to enhance the body's ability to handle contaminants. So to get your body oriented by eating certain foods, a certain type of diet that's probably high in fruits and vegetables, so your body is detoxing out the metals. And the next step is specific supplements and chelation therapy, which is a type of IV process that moves certain type of supplements and liquids through your system to eliminate out the toxins. And you may or may not need that. And it depends on what state your body's at. And then the dentist will do an in-depth analysis of your mouth to determine the order of removal of your amalgams and the most compatible type of dental procedure and materials to use. At that point, the dentist will begin removing the amalgam. The third point is proper diet and chewing. The type of food we eat is essential for maintaining a healthy dental care. We need to replenish good bacteria in our gut so the healthy bacteria in our mouth can provide optimum benefits. So we have good bacteria in our gut that also we have bacteria in our mouth, and they work together. It's all part of the whole digestive process. Food goes into your mouth, goes through the process of digestion, and lives in a healthier flora environment in your gut. So they work together. Eating a balanced diet of fresh whole foods with proper alkaline and acid pH is critical as acid foods can cause greater tooth decay and upset the saliva and mucus terrain. So that's another point, your acid alkaline level. So certain foods are alkaline, certain foods are acid. If you eat more of an acid diet, which is full of meats, full of dairy, wheat, sugar, the foods that we are not going to talk about, those are foods that are more acidic. So you want to have a balance of 80% alkaline and 20% acid. Vigorous chewing, the mastication, exercising, your teeth, your jaw, the esophageal muscles also are really essential to stimulate saliva and the digestive enzymes also, and helps with regulating stomach acid, and creates a cleaning effect on the enamel surface of your teeth. So that's an added plus. So chewing your food is really essential because you're breaking down the food into a liquid, which makes it much easier for your stomach to digest. Plus, it's better for your overall gut health and the intestinal lining. While it can get costly to get the amalgams removed one at a time, I think it's really worth it in the long run, and maybe you have a health plan that can help with those costs. But I think it's really essential, and you can do it over a period of time and do it where it's affordable for you. And there are a number of tests you can do as well on your own to find out your own heavy metal levels, where you're at that point. You can get it done through two different labs. One is called Rocky Mountain, the other one is CanAlt. They're both available online, and if you go to my website, I will have it on my today's blog, the same title, 3 tips for reducing for safe dental care, and I'll give you those links are in the blog, and then you can do a hair analysis test or a blood test that will give you those results. So thank you again. I think that's it for today. I really appreciate your time with me. You can join me next week for another topic that I'm going to address on Parkinson's disease and brain health, fitness, mindfulness. I incorporate it all. And before you go, please sign up on my Facebook page. Under the banner, there's a sort of a red arrow, and just under that, you can grab your free 7 key tips for reducing Parkinson's symptoms, and which you'll hope to have some major results in 30 days. You can also go to my website, thewellnesswagon.ca/Parkinson's, and get it there as well. And I also hope that you will like my Facebook page as well. So have a great week, and thank you again, and I hope to see you next week. Bye-bye.